So we're gonna start on this outer lateral aspect of the foot. The sciatic nerve reflex will come down here. I'm just gonna show you drawing the whole line first. Pass through here. It'll continue on the heel of the foot, and then it'll actually wrap around from the heel of the foot. It'll actually then course up and then all the way back up here. So you can see it's actually, the reflexes are going all the way around and then back up again. Someone experiencing pain will actually often experience like a shooting down pain down the outer leg, sometimes even in the inner leg. So you're gonna wanna use thumb walking. With thumb walking, you're just using this joint, going down and back up a little bit. You're gonna go in with constant pressure, just lift up a little bit and then back in again when you're doing the thumb walking. So we'll start here, and we're gonna do it in one sweep, and we'll wanna do that with both feet. So you'll start here, and you're just gonna thumb walk the sciatic nerve reflex. It could be very intense if somebody either has a problem in that area, or even someone that has tightness in their hips. So you can see now we're coming down here. We're about to wrap around to the heel. So you go through the heel reflex, and you're gonna pass through now on the inner side. And from the inner side, you can use finger walking. And I'll show you on the other foot too, so you can see it from that angle. But I'm just continuing and finishing up there. Now we'll do it on the other foot. So on this side, we'll be here. So you could actually start this way too. Either side, it doesn't matter. You come down through here. It can be really tender, so check in with your person. And if there is an area of tension, just kind of lighten up your pressure. You could even stop there for a moment and just hold, and then move on. And I always like to, especially when doing a protocol for a certain area of the body, while we just did the sciatic nerve reflex, I also want to give attention to the lymphatic groin or fallopian tube reflex for her across here using finger walking techniques. You do one at a time or both at a time. Sometimes it's a little bit easier if you come from the medial aspect, the inside, and then come out. I'm using my middle finger here. And of course supporting the foot with my other hand and my thumb. I'll always give a little extra attention to the lower back in here on both sides. And then I'll end with a little bit of ankle traction. When ending any protocol, it's nice to end with that solar plexus hold. That's coming up through here, right below the ball of the foot, about midway through. Your thumbs press in, right, center there, and then you just lean forward a bit. And that'll be your protocol for relief for sciatica using reflexology.